Okay, so this is today's class. We're going to be doing the essentials, strength, stability, and balance. And again, for today's class, we're going to need a chair, a mat, and a stretch strap if you have one. So we're going to be doing positions from your back, on your hands and knees, standing, and all on your stomach, all those different positions. So today's focus for class is going to be exercise to prevent and manage low back pain in Parkinson's. So it's one of those things that has come up actually in a lot of our programs and for a lot of our clients over the course of the past few weeks. Inevitably, we're all at home a little bit more, kind of out of our normal routines, and that typically means that we're sitting a little bit more, or you're doing various things around the house that you probably weren't doing as much of before. So we've been seeing a lot of that low back pain creeping in, so I wanted to spend today's class really focused on giving you stretches and exercises that are going to help keep your body loose and limber to kind of relieve some low back pain, as well as build your core up and your stability to prevent low back pain from getting any worse. But one thing I strongly recommend is that if you guys currently have low back pain and you're able to see a physical therapist, we are your exercise professionals. We can help you become stronger and help you be more mobile. But if you have acute chronic back pain, make sure you get in touch with your physical therapist or a doctor, and they can help kind of diagnose specifically what exercises are going to be most beneficial for you. All the movements that we do today, if you do experience any pain with them, obviously we don't want to push through those. And I'll try to show as many modifications as possible to make sure that we can do any of these exercises from any position, whether that be seated or lying down. But really important just to listen to your body. And I hope that these exercises will help you be more mobile and a little bit stronger before the end of the day. So this is going to be our workout for today. We're going to be doing a little bit of a warm up. We're going to do a toe touch test to kind of see how limber we are before and after the workout. And then we're going to finish today's workout with a 1-minute sit to stand test. So look forward to it. Let me unshare my screen here. And we will get started. Okay. Hold on one second. So let's start by standing up. Okay, find a comfortable place to stand. Make sure you have arms distance away from any object next to you, all right, or around you. Make sure the floor is clear of all obstacles. If you're sitting down, make sure you have enough distance to move, rotate, and kick your legs out as we go through and do these exercises. So let's just start with a big wide side step just to get that body loosened up, kind of a modified jumping jack, almost into a side lunge. So you're stepping out to the side and driving those arms up nice and high, going side to side. Okay, let's do 10 more of these. Let's count them out nice and loud. 1, 2, get it a little bit deeper. 3, a little wider with that lunge. 4, 5, 6, 7, 8, a little bigger, hold it a little bit longer. 9, hold it here. Open up those arms. Nice tall posture. Back into the middle, other side, hold it open. Nice big tall posture. How's that body feel this morning? We're waking it up. Okay, let's go into a high knee march. Opposite arm, opposite leg, driving those knees up nice and high. This can obviously be done from a seated position as well, just sitting in your chair, marching those knees up nice and high. Okay, we just want to get the body loose and limber before we go into any kind of major stretching, especially with that low back. You want to make sure that the body's warmed up. You've had a cup of coffee. Hopefully you all have. It's a little later in the morning here. And let's go with a nice big twist here. So twisting motions, if any of you guys have scoliosis, spinal stenosis, twisting and rotating or extreme flexion and extension can be contraindicated, which means you shouldn't be doing them. So that's where it's really important to talk to your physical therapist, talk to your doctor to know what you can and cannot do. As you rotate here, like we throw a lot of our punches in some of our other classes, it's important to work your hips along with the trunk. Sometimes we want to kind of what we call disassociate the hips with the shoulders, okay, to improve more mobility. But here, especially to protect that lower back, rotate the hips with the shoulders. Let's get 5 more of these. There's 1, big arms, 2, 3, 4, and 5. Okay, Nice general light warm up. Again, just to get the body and the blood flowing. So what I want everyone to do is, whether you're seated in a chair or you're standing, if you're seated, we're gonna do a toe touch test. So if you're seated, you're gonna extend both legs out to the front, posture is up nice and tall, and you're just gonna reach down toward your toes. And how far can you reach forward? Okay, don't feel like you have to touch your toes. You wanna make sure your knees are straight. Okay, you don't wanna bend your knees, that's cheating. Okay, make sure those legs are straight, and you're just reaching down as far as you can. If it's at your knees, that's fine. If it's at your shins, that's good too. If you can get all the way to your toes, that's great. If you're standing, we want to do the same thing. Make sure you have good enough balance if you're standing and you're reaching down towards your toes. Okay, so just see how far down you can reach without bending your knees, and then come back up nice and tall. Let's do that 2 more times. The more you do it, the more mobile you'll become. And now pay attention to where you're feeling this as well. Are you feeling it in the low back? Are you feeling it in your hips? Are you feeling it in your back of your legs, in your calf? That should tell you where a lot of that tension resides in your body right now. Okay, and that's going to tell you, hey, I need to stretch these muscles out, which is what we're going to do right now. So our first stretch. So the first half of the class, we're going to go into some stretches. Second half of class, we're going to be going into some exercises. So the first 4 stretches that we're going to do are good mobilizing exercises to get your low back loosened up and all the muscles surrounding it. So I asked you to have a stretch strap for today. I just have a gait belt here. You can use any kind of belt, a towel, a rope. This is going to be done or used if you're on the floor. You can use it in the chair as well. We're just going to be doing a hamstring stretch to start off with. So you're going to take that strap. If you don't have a strap, that's fine. You can wrap it around the ball of your foot. You're going to hold both ends of that strap, extend your leg out. And again, anytime you're stretching the hamstring, we really want to make sure that knee is nice and straight. You're going to gently pull up on the toe and then lean forward toward that leg. Okay, so kind of your nose is pointed forward toward your toes. Okay, if you're on the mat, okay, this is a great way to do it. You can strap or wrap that band around your toes. You're lying down. If that's tough on the low back, you can bend the knee up. And you're just reaching that leg up as high as you can go. Relax that head down. With all these stretches, what I recommend for all of our clients is hold them for 3 to 5 deep breaths. If it's hard for you to get a deep breath, try to slow that breath down as much as you can, focusing on a long exhale, okay? And that should equate to somewhere around 15 to 30 seconds, okay? Depends on how long and deep your breaths are. After 3 to 5 deep breaths, you're going to lower that leg back down. If you're in the chair, you can kind of just bend that knee up, release the tension on the muscle, and then we're going to go up and do that side 1 more time. Okay? So get a good stretch. You want to feel it right in the back side of the hamstring here, maybe a little bit in your calf. The nice thing about the stretch strap is that when you pull down on the toes, or the farther forward you are on the toes, the more stretch you get in your calf. You get a little lower leg mobility and ankle mobility in here as well. Okay, mine are pretty tight, so it feels pretty good. I rode my bike into work today, so nice. This is a nice stretch for me too. Let's lower that leg back down. We're going to switch sides. Okay, so let's put that strap into the other foot. One thing that's really important, what I find with a lot of our clients with any kind of low back pain, and especially for those of you who have Parkinson's, it typically affects one side more than the other, right? So you're more rigid on one side than you are on the other side. Let's go up into that stretch if you haven't already. Okay, raise that leg up as high as you can. So you're going to notice you might be feeling more tension on one leg than the other leg. Those things are really important to pay attention to. And whatever side you feel more tension on, that's the side that you got to stretch a little bit more. Okay, that's the side that's probably a little bit tighter, a little more rigid. And what happens is when you have those imbalances in your muscle flexibility, that impedes your mobility. You don't use those muscles quite as much, or you're not able to go through the full range of motion on those muscles as much. Let's switch sides, or I'm sorry, bring that leg down, relax. We're going to go up into it 1 more time. Same hamstring stretch, okay? Today's workout's probably going to be a little lower intensity, but I think it's a really important topic for us to cover when we're talking about essentials to help you guys move better, feel better every day. This is a big one for a lot of our clients, even for me. I'm sitting down a little bit more than I was pre-COVID just because there's a lot more desk work to do. and you get tight. Okay, let's relax from there. Let's take the strap over to the side. We don't need that anymore. All right, our next stretch is going to be what we call trunk rotation. We've done this one a lot in classes, at least that I have instructed for you guys. One of my favorite stretches for you to do. Let me reverse around here so you can see me a little bit better. You can do this from a chair. Let me demonstrate that one first. So when you're sitting in a chair, okay, sitting up nice and tall, you want to take your knees kind of over to one side of the chair. This one has armrests on it, so it's going to be a little bit harder. If you have armrests, you can scoot as far forward to the edge, but don't fall off. And then you're going to rotate over one shoulder. So you want to kind of use one hand on the outside of your knee here, and you're looking over the shoulder on the other side, taking 3 deep breaths. You're trying to rotate a little bit more. If you're on the floor, okay, if both knees are bent, arms are out nice and wide, we're going to take the knees over to the side. Okay, 3 deep breaths here. In through the nose, out through the mouth. Feel a stretch maybe up in the chest, maybe in the mid to low back, and maybe in your hips. That's what's good about this stretch, is it hits a lot of different places. Okay. Let's come back to the center. We'll switch sides. So knees back into the middle. If you're in the chair, switch your knees over to the other side. Reach around, look over your shoulder. And from here, stretch those arms out nice and big. Open up those fingertips too. Make sure those hands are pointed up toward the ceiling. It's those little things that really help you get a little bit deeper into a stretch. Look over. My knees are going to the left, so I'm looking over my right shoulder. If your knees are going to the right, you want to look over that left shoulder. Again, just getting a little bit more range of motion. And breathe, everyone. Okay, and breathe. Now, if you feel it, this one's one of my favorite stretches. I don't want to spend too much time on it today. Let's do another quick one on each side. But again, if you feel it more on one side, come back after class and do this a couple more times. All these stretches are great ones to do when you wake up in the morning after you've moved around a little bit, and before you go to bed at night. If anyone has a restless leg, or you wake up and you're really, really tight, or you have a lot of back pain in the morning, stretch before you go to bed with these exercises, and that should help. Let's switch it over. Other side, one last time. You should feel like you're getting a little bit more mobility every time. Make sure you're breathing. In through the nose, out through the mouth, nice and slowly. Very good. All right. Feeling good? All right. Last, or 2 more stretches here for us. We're going to do a knee to chest. All right, so knee to chest version from the floor. This is gonna help just kind of release some of the tension in the low back. Okay, you're gonna, from a lying position, you're bring one knee up, hug that knee up, and then you can bring the other knee up. You wanna hug those knees into your chest as much as you can. You can kind of tuck that chin up to really round that back out onto the floor and rock back and forth a little bit if you want to. Otherwise, just relax that head back and pull those knees up. And that's just gonna help round out that back and flatten it into the floor. So keep holding that there, 3 to 5 deep breaths. If you're in a chair, I recommend just doing this one knee at a time. Okay, so just pulling that knee up, keeping that chest up tall, or even kind of leaning back in your chair. All right. Again, this goes into hip extension. So we're trying to loosen up those muscles of your glutes and the back side of your hips and that lower back. The next stretch is going to be flexion. So we're going to be extending the lower back, trying to go in the opposing direction. So a lot of times when we see clients coming from physical therapy with low back pain, commonly you do a couple different types of movements, and it depends on the type of low back pain you have. Either you do more flexion or extension based exercises. So this one might cause a little bit of discomfort, so don't do it. Okay, and the next one might cause a little bit of discomfort. So you got to really, again, listen to your body and make sure you know which one you need to work on. So let's bring the knees down. Let's go into the next exercise. For those of you on the floor, we're going to flip over onto your stomach. All right, this one's called the Cobra. If you guys have done yoga in the past, this is a yoga pose called Cobra. It's not going to be exactly the same way you probably do it in a yoga class, because I'm no yogi, but it's going to be a good low back release. So from your stomach, your hands are going to be right by your shoulders, almost in a push-up position. Okay, your toes are relaxed, so they're pointed down away from your knees, with your feet trying to get as flat as you can to the floor. Your chin is tucked. Okay, so tuck that chin up through your back, And then from here, I'll take a big deep breath in. And as you exhale, push that chest up and off the mat, gazing out in front of you. Okay, what's important is you don't want to hyperextend too much through that spine. You want to keep those abdominals supporting that lower back. And even if you just come up to here, that's fine too. But gaze out just a little bit and then relax it back down. Okay, so what I recommend is as you go up, big exhale, gaze out, hold it for 1, 2, 3, and then slowly come back down. Okay, again, if that causes discomfort in the lower back, go back to that last exercise we did, or a modification here would be child's pose. You can rock those hips back towards your heels here. That's kind of a nice low back release as well. So depending on what's more comfortable for you, if the child's pose is more comfortable, that's great. Go here. If that Cobra helps get some extension, go here. Okay. If that's really tough to be here as well, one modification is just take those elbows underneath your shoulders and just kind of prop yourself up there. All right. Go through that stretch one more time on your own here. I'm going to show that seated modification so you guys have that as well. A seated Cobra is essentially, you can sit back in your chair and reach and extend the arch the back to over the back side of the chair. Make sure you're not going to tip backwards, but open those arms up nice and big. And head goes back to the ceiling as long as it doesn't cause any discomfort in your cervical spine back here by your head. So look back, reach back. Okay, if that's too uncomfortable, if that causes more pain in your back, you're going to reach down toward your toes and tuck that chin down. From here. Okay. All right. Feeling a little more mobile? I hope so. All right, we're going to go into some core strengthening exercises. So let's get on, if you're on your mat, get on the hands and knees. All right, we're going to do a cat-cow exercise. So what we want is in the quadruped position, so your hands are directly underneath your shoulders and your hips are stacked right over your knees. And your hands want to be about shoulder width apart, same with your knees. We don't want anything too close together that causes some instability. We want to focus on stability, right? So wide base of support with your hands and your knees. A cat-cow is exactly kind of like it sounds. You're going to want to make yourself look like a cow and then a cat, not something we typically like to do, right? But with this exercise, that's what we're going for. So for a cat, it's almost like you're a scared cat. So you're pushing your back up toward the ceiling, tucking your chin down, squeezing those abdominals in. Nice and strong. You should feel that release in the lower back. And then go into a cat. I'm sorry, a cow. We're going into cow. It's kind of a slumped low back. So you're kind of pulling your belly button down toward the floor, looking out in front of you. We're still staying strong through the arms. Okay, so don't bend the arms. Keep them nice and straight. We're going to go back into the cat. Exhale. Push that spine up toward the ceiling. For me, that feels really good. Push it up nice and high. Hold it for one deep breath. And then relax back down into a cow. If you're going to want to stick your butt out, okay, stick your butt up, belly down, chest is up. In that cow position, strong through the arms. Let's go up and down one more time. Up into a cat. Strong through those arms. Push your chest and your belly button up and away from the floor. You should feel that in your abdominals quite a bit. And now go into a cow. Push the butt back. I'm sorry, not butt back. Butt up, belly down, chest up. Okay. Very good. All right. Now, the next one, we're going to be going into a plank. All right. So the plank can be done from the mat. It can be done off a chair. It can be done off the wall. All right. So if you're on the floor, you can also do a modified plank from here. So you can be, I want everybody to try to be on your hands. Okay. So you're here. The most difficult version is going to be just like so. So you want to tuck that belly button in nice and strong. The big key with a plank, a bridge, or any of these exercises, you shouldn't feel pain in the low back, right? If you're having pain in the low back, you know, we're not doing something correctly. We want to add stability and strength here to help protect your back here. So if you have any pain, discomfort, check with me after class, or we can check in following class, and I can try to help walk you through that. But in that plank, tuck that belly button in strong. Modified version is going to be right from the knees. All right. If you're from the chair, obviously, you can put your hands on the seat of the chair. Okay. Make sure the hands are on the seat of the chair, not the arms, because you don't want it to tip on the wall. Same idea. Big straight arms. We're going up for a plank. We're going to hold it for 30 more seconds. If you're already there, great. But let's go. 30 seconds of plank. Okay? Hold it strong. Belly button in nice and tight. If you're feeling some instability in those arms, they're working hard. You should feel this maybe in your shoulders, abdominals, hips. It's all working together. Okay, we're going to hold it for 5, 4, longest 5 seconds of your life, 3, hold it strong, 2, and 1. Drop the knees down. Let's go back into that child's pose. Help release that low back, okay? Take one deep breath, pushing your butt back towards your heels. Arms are out in front of you. All right. Let's come back up to that starting position. All right. Now the next one is what we call bird dog. All right. So we've done these in class before, but again, we're in that same position we did for the cat-cow, in that quadruped position. Now with this exercise, you're going to be extending opposite arm, opposite leg, and then you're going to be tucking back into the middle. I don't know if we've done this version before, but you're going to reach and extend, arm out, leg back, and then tuck the knee into the hand. All right. If you're doing it from a seated position, what I want you to do is reach out and then tuck in. Reach out as big as you can, extend that leg, extend the arm, tuck in. All right. So we're going for 10 on each side, everyone. Okay. 10 of these on each side. Are we ready? If you're already going, good for you. We're going to do a little few bonus ones. Okay. I'm going to start with my left hand reaching out, right leg kicking back. If it's too tough, you can just do the legs and tuck it in. There's 1. Extend and back in. Tuck it in. There's 2. Be strong through that down arm. So that's my right arm. Here's 3. Tuck it into the center and extend. A little pause on that extension. Tuck it in. There's 4. Extend out. In. There's 5. Out. And in. There's 6. Out. And in. 7. Out. In. 8. Out. In. 9. Out. In. 10. Very nice. You might be saying, I want to go faster. It's hard to go slower. Speed will always mask stability. So with all of these exercises, any kind of core strength, we want to go nice and slow, okay? That'll help build your stability, build your strength. It hurts now, but you're going to thank yourself later, okay? Let's go other side, all right? So I'm extending my right arm, kicking my left leg back. Are we ready? And extend. And in. That's 1. Out. Make sure you get that leg fully extended. In. There's 2. Eyes are kind of gazing down toward the floor. There's 3. Out. Reach that hand as far as you can. And in. There's 4. Keep going. Okay? Keep going. This is 5. Out. If that's too tough on your shoulder, okay, just work the legs. There's 6. Out. And in. 7. Out. And in. There's 8. Out. And in. 9. Out. And in. 10. Yeah, that's 10. All right, I'm trying to get ahead of myself here. All right, so that's the bird dog, okay? I don't want to go through another set right now, but you guys, whatever exercise was the hardest for you, go back and do it again, okay? I want to get through all of these exercises today. Try to keep this workout to around 35 minutes or so. But even if you can only go through one set, do whatever you can. Pick the one that's the hardest. Make sure you get those in because that's the one you need to work on the most. All right. Last and final one from the floor, and then we're going to be working up onto our feet, is going to be a bridge. All right. Really basic core strength, stability, low back strengthening exercise. A lot of times our clients will feel this in your lower back when you really shouldn't. Okay. This is a great exercise to help strengthen up your glutes and your hips and your core. So we've done a lot of bridges. And if you've been in PT, you've probably done a lot of bridges there as well. What's really important is you know what you should be feeling when you're doing these bridges. You should feel it in your butt, maybe your hamstring, abdominals, not in the lower back. So before we even start, let's get the hands at the side, heels tucked back, knees and feet about shoulder width apart. All right, squeeze your belly button in. You gotta push your back into the floor. All right, tense up your butt like you're clenching your butt, and then lift. Okay, if it's only here, that's fine. Lift only as high as you can. If you can go up a little bit higher, great. But when you go up higher, you should be feeling that intense squeezing of your hips and your glutes, not your back, and slowly lower it back down. Okay, let's lift up, hold it, and down. There's one. Lift up, pause and hold. There's two. If you want a little added challenge, you can lift up into one leg bridges. Again, you don't want to feel it in your back. There's three. Lift up. If you want to lift that knee up, go for it. Okay, and down. There's four. And up, hold and squeeze your glutes, abs tight. And five. Up and down. That's six. Up. Again, speed will mask stability. You want to go as high as you can. Hold it there. Slowly release back down. Was that seven? I think so. Up. And down. There's eight. Up. Hold it, hold it, hold it. And down. There's nine. We're going for 12, everyone. Up. Hold it. And down. 10. I'm really losing track of my count today. Up. And down. 11. One more time. Let's hold it up on this one. Hold it up there. What are we feeling? Okay. If you're feeling the low back, drop it down a little bit. If you're not, hold it up strong. Keep holding. Keep holding. Keep holding. Oh, it should burn. It should burn. You should feel the burn in the hamstrings, in your butt. Let's go. Let's go. Let's go. Let's go. Hold it. Hold it up. Keep the butt up. We're going to use this motion for our next exercise. 5, 4, 3, 2, 1, and relax all the way down. Nice job. Take some time. Get yourself up and off the floor safely. All right. We're going to come up onto your feet. We're going to apply a lot of these motions now to a standing position. So really important that we help build stability and mobility on the ground with core strengthening exercises and stretches, but then we got to make it functional, right? When does low back pain typically kick in? It's not when you're lying down on the mat. Maybe it's when you get out of bed in the morning, right? But it's when you're doing things throughout the day. So I want to apply all of that functional strength that we just built into 2 exercises that you do all day long, squat and lunge, okay? So from a chair, if you have the chair nearby, you can work on getting up and down from a chair, but I want to talk about a squat real quick, okay? So feet about shoulder width apart. This is very functional if you're going to pick something up off the ground. We don't want to do this, right? Look how exposed my low back is, all right? This is going to injure, especially if you're lifting something heavy like a clothes basket or a thing of dog food or, whatever it is. That's going to put a lot of strain on your lower back. The muscles that we just strengthened in your butt and your legs, those are the strongest ones you have. We got to use them, all right? So feet about shoulder width apart, okay? When you squat down, your eyes should be focused out in front of you. Don't look at the floor, okay? We're squatting down, either arms at the chest or arms out front. Get down low and come up nice and high. You want to pretend like you're sticking your butt back, okay? If you need that chair for a little bit of a cue, we always do our sit-to-stands, right? So you're sitting back, you can tap your butt on the chair and pull up nice and strong. At the top, that bridge comes in handy from here. Sometimes it's hard to get out of a chair. Bridging those hips up, that's what we got to do, okay? Bridge up at the top of that stand. Squat down, butt back, eyes are up. Again, look at my back. We want to keep it nice and straight. Pretend like you're picking something up off the ground, okay? Reaching down to the floor, keeping that back up strong and up nice and tall. We have 5 more of these. Down and up strong. There's 1. Down, up strong. 2 and down, up strong. 3, down, up strong. 4, last one, down, up strong. 5, very nice. Again, we're not getting the heart rate up immensely today, okay? But these should be very focused, exercise when we're working on things to prevent pain. We got to build stability, and that comes with going a little bit slower. All right, our lunge. Sometimes we do a side lunge like we did in the beginning of class. Sometimes we lunge forward. Lunge is just an exaggerated step in one direction, right? Oftentimes, when we lunge out here, that throws our balance off. All right, balance is one of the things we want to work on in this class. So all the muscles of your core and your hips that help protect your lower back are also going to help you improve your balance as you go to lunge out here. Okay, same principle. Shoulders are up, chest is up tall, shoulders are right over your hips. We don't want to be lunging forward. We're going to stay on that right leg. We're going to lunge out, hold that weight on that right leg, open those arms up. If you need something to hold on to, have a counter, a chair, a workout partner nearby. Challenge that balance. Okay, step out as big as you can make it. If you want to make it a little more intense, you can drop that knee down, but really maintain that posture. 90% of your weight is in that front leg. Okay, and back. Let's do 5 more lunges just on that right side, going forward, stepping forward, hold. Posture is tall, arms are out. If you want a little more of a challenge, you can also take your arms up. It's a little bit of a warrior pose here, okay? And back, that's 1. Stepping out, hold that balance, up, posture's up tall. And back, there's 2. Only step as far forward as you can step back with comfort and ease. Okay, you don't want to be losing your balance as you step back out of this position. And back, there's 3. Step forward, feel that burn in the front leg. Come on, get that posture up, nice and tall. And back, that's 4. Stepping out, ooh, get that balance, posture's up, like a tightrope walker, right? And back, that's 5. Other side, last 5 on this side. Then we're gonna do a 1-minute sit to stand test, okay? Lunging forward with that left leg. Again, one side might have a little bit more stability than the other. When we go to take a step, if you have to react quickly, okay, we need stability. That's gonna help protect your back. If you're reacting by stepping in one direction, keeping that posture tall, stepping forward, loading that weight on that front leg, building stability in your knees, your hips, all of the muscles of the lower body and your midsection here is gonna help prevent the pain in the lower back, okay? Big step forward, posture is up, nice and tall, and back. We got 2 more. Big step forward on that left leg, load it up, 90% of your weight in that left leg. Stay strong, open up that posture, and back. We're gonna hold this last one a little bit longer. Big step forward, only as far as you can hold it. Work on that balance, work on that strength. Arms are out or up, whatever you wanna do. If you wanna go in between, we're holding it for 5, 4, 3, 2, and 1. Big step back. Nice job. Okay, shake those legs out a little bit. Let's do this. We did the toe test, the toe touch test in the beginning of class today. All right, let's reach down from wherever you were. Let's get into whatever position you were in before, whether that was seated or standing. Let's reach down and touch our toes. Okay, we're gonna do it 3 times. Let's see how low we can get. So before you go down, big deep breath in. Exhale. Go down, touch your toes. We did a lot of core work today. You might even feel a little bit more tension in that back right now. But stretching those hamstrings out after you do all these exercises is really good. Deep breath in. And out. Reach it down to the floor. Or if you're in a chair, reach down toward the toes. See if we can get a little bit farther. Okay. Test, retest, right? Shows progress or areas that we need to work on. One more time, deep breath in and out. Reach down toward those toes. This is tough on the balance. Please, please, please do it from a chair. Okay. You get the same benefit from the chair. Good. And let's come back up. Now that we had a nice relaxing stretch, we got 1 more exercise. 1 minute of sit to stands. Okay, you are testing to see how many sit to stands you can do in 1 minute. We did these maybe 6 weeks back. All right, let's see where we're at today. So make sure your feet are nice and wide, arms crossed over the shoulders. All right, If you do 5, great. If you do 1, that's fine. If you do 20, that's great too. Do what you can, as many as you can in 1 minute. I got the clock ready, and go. All the way up and down. Make sure you're counting your reps, however many you can do in 1 minute, okay? 1 minute of sit and stand. Make sure you're powering up using those muscles we worked on today, as many as you can, okay? If you fall back in your chair, that does not count, okay? And you gotta slow it down and assess your form to have better function, okay? All the way up, nice and tall. We got 30 seconds to go. What number are you on? Okay, what number are you on? Count it out loud. Let everybody in your house or your neighbors know how many repetitions you got. Okay, be nice and loud. Come on. At the end, don't speed it up. Okay, get as many as you can safely. Let's go. We got 10 seconds. 10 seconds, finish nice and tall. Let's go. We have 5, 4, 3, 2, 1, and relax. Woo! Nice job, everyone. Thank you for joining me today. All right. I hope you liked the class. If you guys want to stick around, we'll chat for a little bit.